Assalamu alaikum and good evening, everyone. It's my pleasure to be here today at Professor Murtada Shabrawi's conference. Professor Murtada, I would have certainly wished to have been there with you in Hurghada this year, but of course we are in these pandemic times, and so we are still happy to participate in this manner, at least until hopefully next year things will be back to normal and we'll be able to join you face to face. At the beginning, I'd like to hope that everyone is safe and healthy as we deal through these times. And as always, we at Liptus Nutrition continue to support all the continuing medical education conferences and events as we go through these unique circumstances. We'll start our presentation with the slide that all of you know very well and is quite familiar to all of you, that breast milk, of course, is always the best choice and the #1 option for infant nutrition. This is as it always should be. And of course, we as a company only compete with all the other infant formula companies. If breastfeeding is not available or possible for any reason, then Liptomil Plus provides the unsurpassed alternative under those circumstances. We have our Liptomil Plus 1 and 2 and Liptogrow Plus 3 for those age 1 and older. Of course, our formulas are fortified with AADHA, prebiotics, the GOS, and the 5 major nucleotides for healthier infant growth and immunity. Our focus today is going to be on our FSMPs, the food for special medical purposes. With that, we will start with our Liptomil Plus AR, which is now available again throughout the market in Egypt. This is our formulation made with added carabin gum, indicated as an anti-regurgitation formula. The gastroesophageal reflux, we know, is the passage of the gastric contents into the esophagus with or without regurgitation. That is a normal physiologic process that occurs in healthy infants and children. It is gastroesophageal reflux disease that becomes problematic when this reflux has pathological consequences, including esophagitis, nutritional compromise, or respiratory complications. The pathogenic factors in GERD include the relaxation of the transient lower esophageal sphincter, coupled with increased intra-abdominal pressure, that in addition to reduced esophageal capacitance and delayed gastric emptying. And so when you see in this image, in the normal instance, the sphincter here is closed and the gastric contents pass down through into the small intestine. In GERD, this lower esophageal sphincter is open, and so it allows the gastric contents to reflux back into the esophagus. Complications of GERD include failure to thrive, because the persistent and repetitive regurgitation episodes reduce food intake, which compromise nutrient and energy absorption, and this then manifests in terms of failure to thrive and poor development. The prevalence of regurgitation peaks during 4 to 6 months, and of course it starts from birth onwards. It reduces dramatically in the last 3 months to 6 months of the first year of life. Liptomil Plus AR is a pre-thickened infant milk formula made with carabin gum for infants suffering from recurrent regurgitation or GERD. Carabin gum is the galactomannan vegetable gum extracted from the seeds of the carob tree, and it is used as a thickening agent. Unlike digestible thickening agents such as starch, which is broken down by salivary amylase, carabin gum is not broken down by these enzymes and thus maintains its thickening effect even upon reaching the stomach. And because it is non-digestible, the carabin gum content does not alter the energy calculation or the osmolarity of the infant formula. Carabin gum has been specifically developed to be mixed with infant formula. It thickens the infant formula and provides a prebiotic effect that supports the beneficial bifidobacteria in the large intestine and reduces constipation. If we do a head-to-head comparison between carabin gum and Liptomil Plus AR and cornstarch used in other formulations, Both provide thickening properties to the formula. Only the carabine gum provides prebiotic properties. Cornstarch gets dissolved and digested by the salivary amylase in the mouth, whereas carabine gum is resistant to that. Because cornstarch is dissolved and digested, it alters the energy and caloric content. Carabine gum is non-digested, and so it continues and provides prebiotic properties which do not alter the osmolarity as in cornstarch. Liptamil Plus AR contains the carabine gum, which is effective in decreasing esophageal acid exposure, the total number of visible and measurable instances of reflux, reduces the reflux related symptoms, and the height of the reflux when it does occur in the esophagus. Consequently, the body weight loss in infants suffering from recurrent regurgitation and vomiting is reduced. Total reflux is reduced by about 68%, and acid reflux is reduced by about 33% when using a carabine fortified thickened formula to treat gastroesophageal reflux disease. Liptamil Plus AR decreases excessive regurgitation episodes and vomiting frequency and volume compared to unthickened formula by up to 50%. Liptamil Plus AR contains the appropriate energy content, osmolarity, and nutrients to meet the infant's nutritional needs, unlike adding a thickener to a regular infant formula. Liptamil Plus AR contains carabine gum, which is safe and well tolerated in infant formula. It is a palatable product, and the carabine gum component is a natural water-soluble fiber with thickening properties. It is not broken down by salivary amylase enzymes, maintains a thickening effect after reaching the stomach, stimulates the growth of beneficial bacteria, and enhances peristalsis and bowel movement for better digestion. Liptamil Plus AR is fortified with the prebiotic galacto-oligosaccharides for better GI function and immunity. Liptamil Plus AR is fortified with AADHA for better visual and cognitive development. And Liptamil Plus AR is fortified with the 5 major nucleotides which strengthen the immune system, reduce incidence of diarrhea, and improve immune system response to vaccination. Liptamil Plus AR contains iron at the optimal ratio to vitamin C to prevent iron deficiency anemia and lower the incidence of constipation, because vitamin C is an iron absorption enhancer. And so this maximizes the absorption of the iron, pulling it out of the GI system and into the bloodstream where it is needed to prevent iron deficiency anemia. And because of the reduction of iron in the GI, this consequently reduces incidence of constipation. Liptamil Plus AR is sucrose-free to be easily combined with breast milk with no risk of breast milk rejection. To summarize, Liptamil Plus AR is a pre-thickened infant milk formula made with carabine gum for infants suffering from recurrent regurgitation and or gastroesophageal reflux disease. We turn our attention now to our other specialty product, Liptamil Plus HA, the hypoallergenic formula. We know that cow's milk protein allergy is the leading cause of food allergy in infants and young children under 3 years of age. Cow milk protein allergy is defined as the abnormal reaction by the body's immune system to the proteins found in cow's milk. It seems to peak during the first year of life with a prevalence of 2 to 3% in the overall infant population. The prevalence then decreases to less than 1% in children 6 years of age and older. Additionally, some exclusively breastfed infants have also been found to develop clinically significant cow milk protein allergy by the dairy protein transfer through human breast milk. This is at about a 0.5% incidence. Now, if the infant has no family history, there's still a 5 to 15% risk of developing cow milk protein allergy. This actually is one of the drivers of the new recommendations moving in the direction of starting infant nutrition on formula with a hypoallergenic formula because of the inherent risk, despite the absence of any family history, of an infant developing allergy of any type. If there's one atopic parent or sibling, the risk jumps dramatically to 20 to 40%. If there's an atopic parent and an atopic sibling, it increases further to 40 to 60%. And if both parents are atopic, then the risk is nearly 80% of that infant developing cow milk protein allergy. And so it's important to understand and take a complete and thorough family history before making any recommendations on the use of infant formula if the mother is not able or chooses not to breastfeed. So the reason why infants are at risk, even in the absence of any family history, the theory involves many different aspects. One is that the infant's digestive enzymes are not fully active. There is an immature secretory immunoglobulin A, which reduces the integrity of the intestinal barrier. There's increased permeability of the mucosa, and this allows undigested proteins to reach the immune system. This, coupled with infants that may be administered proton pump inhibitors to reduce gastric acidity, provides additional risk. And so because of the increased incidence of cow milk protein allergy in infants, new primary prevention strategies and guidelines have been introduced, and they are also in the process of being updated. Now, as a brief review, when we look at the standard cow milk protein, it is a large molecule of an intact protein of about 10,000 Daltons in size. A partially hydrolyzed formula breaks these intact proteins into large peptides. Extensively hydrolyzed formula break these large peptides into small peptides, and of course, the amino acid formula is the most basic form. And so the partially and extensively hydrolyzed formulas are hypoallergenic. Amino acid-based formula is non-allergenic, but of course, this is the most unpalatable formula that is available. The hypoallergenic formula that is partially hydrolyzed is only used for prevention, whereas both the extensively hydrolyzed and the amino acid formula both are used for treatment. So when we look here at the size of the molecules, the whole cow milk protein is about 10,000 Daltons. Partially hydrolyzed whey is about 11% of that size, and the extensively hydrolyzed casein formula is about half of that further size. Now, the Middle East Consensus Algorithm for the Prevention of Allergy included guidelines looking at the intention of the parents on how to feed their child. So of course, if breastfeeding is the chosen and of course the most ideal option, and it will be used exclusively, then the mother should simply breastfeed for 4 to 6 months. If the mother, however, will be looking to partially breastfeed and partially formula feed, well, then you should continue exclusive breastfeeding until an allergy risk assessment is conducted. And so either if breastfeeding will not be exclusive or if breastfeeding will not be used, then you have to check to see if a history of allergy on family members has been obtained. If not, then use partially hydrolyzed formula until an allergy assessment can be conducted. Once an allergy assessment is conducted, if it is positive for one or more immediate family members with atopic disease, then you should use partially hydrolyzed formula throughout. If there is no family history, then you can use a standard cow milk formula, or, and here's the big difference, consider a partially hydrolyzed formula. So you see here, highlighted in bold red rectangles here, we have the differences in some of the recommendations and the guidelines. In the past, when the mother is exclusively breastfeeding, that's it. That remains unchanged. The mother only breastfeeds, no further intervention is required. However, here in the updated recommendations, there is an additional point for mothers that partially breastfeed. And so if a mother partially breastfeeds, you still must undertake a complete family history in order to determine whether or not hypoallergenic formula should be used to supplement the breastfeeding. Because if there is a history of atopy, then you must use the partial hydrolyzed formula. Of course, if there's no history, the new direction is to consider a partially hydrolyzed formula only because infants are still at risk. 5 to 15% of them have a risk of developing allergy regardless of any other underlying family history. And so if the parents are economically able to do so, you can consider using partially hydrolyzed formula. And so Liptamil plus HA is a specially designed formula for healthy babies with an increased risk of developing allergy. Liptamil plus HA decreases the risk of developing allergy due to the treatment of the protein. It is a complete formula from age birth to 12 months. The partially hydrolyzed whey protein Liptomil plus HA stimulates the infant's immune system to accept cow's milk protein. The whey protein is partially hydrolyzed, casein is removed entirely, and we hydrolyze using an enzymatic process that provides consistent peptide molecular size with the best taste and scent. When other companies use heat, that provides a burned and foul taste that is less palatable for the infant and is frequently rejected. Whey protein is a fraction of the milk protein that has both nutritional and health boosting effects. The enzymatic hydrolysis of the whey protein can generate bioactive peptides that are found to be beneficial to the life activities and regulate physiological functions. And so these whey protein bioactive peptides can be divided into different categories based upon their physiological effects on the body. Some provide antioxidant effects, others help to increase mineral bioavailability. Furthermore, they provide antimicrobial and immunomodulatory effects. And so when we look at the milk-derived peptides, we look at the functional role and their effect on metabolism. The antimicrobial peptides help to improve the digestive system. The angiotensin converting enzyme helps to improve the cardiovascular system. The immunomodulatory peptides help to boost the immune system. The antioxidant peptides help to scavenge the free radical formation and protect the body against the reactive oxygen species. And lastly, the opioids peptides help weight management and the digestive system. And so when we look at the antioxidant bioactive peptides, they're considered natural antioxidants, and they've attracted a great deal of interest because both of their safety and availability from a wide range of protein sources. So the mechanism of action of the antioxidation peptides involves inhibition of lipid peroxidation, scavenging of free radicals, and chelation of the transition metal ions. The antioxidant effect peptides also exert their effect by intracellular conversion of cysteine to glutathione, which is a potent intracellular antioxidant that keeps cells protected from the damage caused by the reactive oxygen species. Furthermore, whey protein-derived peptides have been shown considerable capacity for binding cations such as calcium, iron, zinc, thus enhancing the bioavailability and absorption. Milk protein hydrolysates and peptides derived from the major whey proteins can enhance immune cell function as measured by lymphocyte proliferation, antibody synthesis, and cytokine regulation. Immunomodulatory milk peptides may also alleviate allergic reactions in atopic patients and enhance mucosal immunity in the GI tract. Now, all of this information is quite new. It was only published last year, of course, in 2019. And so the partial hydrolyzed whey protein in our Liptomil plus HA, we 100% partially hydrolyze it using an enzymatic process. Liptomil plus HA also contains galacto-oligosaccharides as the prebiotics with the 5 major nucleotides. Additionally, we add AADHA, vitamin D, zinc, antioxidants. So when we look at the partially hydrolyzed whey protein, this stimulates the immune system to accept the partially hydrolyzed cow milk protein, and this significantly lowers the incidence of atopic dermatitis among infants at least 3 years followed when compared to infants fed regular formula over the same time frame. This is a proven cost-effective option versus standard cow milk protein prevention in cases of atopic dermatitis for high-risk infants as compared to the cost of feeding them an extensively or amino acid-based formula. When we look at the incidence of atopic manifestations in infants fed partially hydrolyzed whey formula versus the regular cow milk protein, we see across the board in orange that the incidence is dramatically lower when infants are fed the partially hydrolyzed whey formula. Similarly, the cumulative incidence of atopic dermatitis in the hydrolyzed formula versus the cow milk protein, regular cow milk protein formula, again, across the board in orange, we see a dramatically lower incidence. The prebiotic that's used, the galacto-oligosaccharides, this helps reduce the rate of atopic dermatitis manifestations in infants by 44% by its bifidogenic effect and immunomodulatory action. It induces T-regulatory lymphocytes, which help to increase the Th1-Th2 ratio suppresses interleukins 5-13 and the related Th2 allergic response, improves tolerance to food allergens, and enhances the vaccination response. The 5 major nucleotides help to provide immunomodulatory effect and enhance immune maturation. They cause upregulation of antigen-specific Th1 response, immunoglobulin G, enhances the adaptive immunity, and suppresses antigen-specific Th2 response, immunoglobulin E, to reduce incidence of allergic reactions while also enhancing the intestinal microbiome. The 5 major nucleotides further enhance intestinal development by promoting enterocyte growth to protect against immature antigen exposure by sealing the loose tight junction and preventing the antigen from bypassing the GI epithelium. AADHA is included to prevent allergic sensitization, modulate the immune response towards Th1 to enhance tolerance to food allergens, and reduces the risk of skin and respiratory allergic disease in early childhood. Vitamin D is included. This has an important effect on immune system modulation for both the innate and adaptive immune systems by suppressing Th2 type response, and cases of vitamin D deficiency predisposes the infant to GI infections, which may promote the development of food allergy. Zinc, of course, is also included. This helps to regulate unwanted hyperresponsive immune reactions by significant shift from interleukin 10 to the Th1 cytokine and enhance T regulatory cell numbers. Antioxidants, of course, we include selenium at levels found in breast milk, along with vitamins A, E, and C, and L-carnitine, because as you increase the amount of antioxidants early in life, you reduce the incidence of allergic disease. This includes asthma, wheezing, allergic rhinitis, eczema, and atopic dermatitis. And so Liptamil plus HA is indicated to prevent cow milk protein allergy in infants at risk, contains partial hydrolyzed whey protein, reduces the risk of developing food allergy by inducing tolerance to cow milk protein, includes all the supportive nutrients, prebiotics, galactoliposaccharides, the 5 major nucleotides, AADHA, and we enzymatically hydrolyze the whey protein to provide superior palatability. Liptamil plus HA, the hypoallergenic formula from Liptus Nutrition, is available and indicated for infants from birth to 12 months. Just as a brief reminder, when we talk about the milk journey from the cows to the consumers, all the dairy farms that produce the Liptamil Plus range must use plants, fodder, animals, and food which have never been genetically modified, and there's never any hormone or antibiotic or other antimicrobial substance to enhance the performance. From the moment the milk is received until the final product's produced takes no longer than 72 hours, and over 250 analyses are conducted at several steps during the manufacture process. Liptus Nutrition provides the highest quality premium infant formulas with added AADHA, prebiotics, and 5 nucleotides, as well as all other essential nutrients required for the healthy growth and development of infants. We provide a Liptamil Plus 1 and 2, along with Liptogrow Plus 3, and our portfolio now includes back again in the market Liptamil Plus HA and Liptamil Plus AR. Thank you once again for inviting us to share in your annual conference. We look forward to participating with you in future events, and we wish you all to stay safe and healthy and have enjoyable time in Harlata. Thank you once again.